Large intestine 1 is at the radial nail point of the index finger. I'm going to be looking at the proximal and radial borders, looking and feeling for the flare of the bone, looking at where the nail bed is, and putting my point in. Large intestine 2 is on the radial aspect of the index finger. It's just distal to the second metacarpal joint. It's much better to locate this point with the fingers loosely flexed. So moving from large intestine 2 to large intestine 3, over the head of the second metacarpal joint into a significant depression. Again, the hand should be loosely flexed, so in a loosed fist, and you should fall into that point. Large intestine 4, you're going to find the length of the second metacarpal bone. So running your finger down, finding the base, making sure that you're not actually on the carpal bones themselves, finding the midpoint of that shaft of bone, coming between the first and second metacarpals, nearer to the second than the first in the muscle. Large intestine 5 in the anatomical snuff box. I'm going to ask Laurie to extend his thumb under resistance, and that brings the snuff box into relief. And just relax. I'm going to articulate the wrist to find the deepest part of the hollow now it's relaxed. And I'm going to put my point in, which is in between the two tendons of extensor pollicis longus and brevis.
Large intestine points are best located with the arm resting against the abdomen. Large intestine 6 is 3 sun proximal to large intestine 5 on a line going to large intestine 11. What's important about finding this point is that if you think of the arm as being a box, large intestine 5 would be on the top of the box, large intestine 7 would be on the side of the box, but large intestine 6 would be on the corner. Large intestine 7 is located 5 sun proximal on a line joining large intestine 5 and large intestine 11. The point has quite a bony feel. Large intestine 8 is located 8 sun proximal from large intestine 5 going towards large intestine 11. Palpate for a nice groove in the muscle. Large intestine 9 is located 9 sun proximal on a line joining large intestine 5 and large intestine 11. Run your finger along that line and you'll find at 9 sun you'll fall into a nice groove in between the muscles. Large intestine 10 is located 10 cm proximal to large intestine 5 on a line heading towards large intestine 11. Palpate along that line and fall into a nice groove in the muscle at 10 cm. Large intestine 11 is located at the midpoint between lung 5 and the prominence of the lateral epicondyle of the humerus. Typically, this is at the end of the transverse cubital crease when the arm is fully flexed. Large intestine 12 is located 1 cm superior and 1 cm lateral to large intestine 11. Palpate for a nice groove.
Large intestine 13 is 3 cm superior to large intestine 11. It's between the lateral borders of biceps brachii and the shaft of the humerus. If you divide the distance between the anterior axillary fold and large intestine 11 into thirds, the point just lies there.
Large intestine 14 is located on a line joining large intestine 11 to large intestine 15. It's often described as being 3/5 of the distance between large intestine 11 and large intestine 15, but this isn't always very accurate. The best way to find it is to have a person adduct their arm against pressure and then palpate down until you find a nice depression on the inferior aspect of the deltoid muscle. It's important to realise that when the arm is relaxed, this point isn't at the exact tip of the deltoid, it's slightly anterior and slightly superior on a line joining these 2 points. Large intestine 15 is located anterior and inferior to the acromion process at the origin of the deltoid muscles. The easiest way to find this point is to take the weight of the person's arm, extend their arm, and palpate for the clefts between the anterior, lateral, and posterior heads of the deltoid. If you push medially, you should be able to feel the bony extremity of the acromion process. You need to locate this point inferior to the acromion process between the anterior and lateral heads of the muscle. Mark this point when the arm is then relaxed. Large intestine 16 is located on the superior aspect of the shoulder. It's in a depression which is medial to the acromion process. It's medial to the lateral extremity of the clavicle and the spine of the scapula. Palpate to find a nice dip. This point isn't on bone, it's in a nice dip. Large intestine 17 is located 1 cm inferior to large intestine 18, but on the posterior border of the sternocleidomastoid. If a person turns the head against resistance, it should be quite easy to locate the sternal body of the sternocleidomastoid. Mark your point 1 cm inferior, and then have them relax their neck. Large intestine 18 is located on the side of the neck on a contour with a laryngeal prominence. It's in between the 2 bellies of the sternocleidomastoid. To bring the 2 bellies into relief, have the person turn their head against resistance. it becomes quite easy to see the sternal and the clavicular bellies of this muscle. Locate your point in between the two bellies and then have them relax their neck again. Large intestine 19 is directly below the outer margin of the nostril on a level with DO26. Large intestine 20 is located in the nasolabial groove, level with the midpoint of the ala nasi. The ala nasi is the nostril. So find the superior border of the nostril, the inferior border of the nostril, hence the midpoint, and come out into the nasolabial groove.